Diabetes. A disease in which the body's ability to produce or respond to the hormone insulin is impaired, resulting in abnormal metabolism of carbohydrates and elevated levels of glucose in the blood. 1. Type 1 diabetes. The body does not produce insulin. Some people may refer to this type as insulin-dependent diabetes, juvenile diabetes, or early-onset diabetes. People usually develop type 1 diabetes before their 40th year, often in early adulthood or teenage years. Type 1 diabetes is nowhere near as common as type 2 diabetes. Approximately 10% of all diabetes cases are type 1. Patients with type 1 diabetes will need to take insulin injections for the rest of their life. They must also ensure proper blood glucose levels by carrying out regular blood tests and following a special diet. Between 2001 and 2009, the prevalence of type 1 diabetes among the under 20s in the USA rose 23%, according to Search for Diabetes and Youth data issued by the CDC, Centers for Disease Control and Prevention. 2. Type 2 diabetes. The body does not produce enough insulin for proper function, or the cells in the body do not react to insulin. Insulin resistance. Approximately 90% of all cases of a diabetes worldwide are type 2. Diabetes patient measuring glucose level in blood. Measuring the glucose level in blood. Some people may be able to control their type 2 diabetes symptoms by losing weight, following a healthy diet, doing plenty of exercise, and monitoring their blood glucose levels. However, type 2 diabetes is typically a progressive disease. It gradually gets worse, and the patient will probably end up have to take insulin, usually in tablet form. Overweight and obese people have a much higher risk of developing type 2 diabetes compared to those with a healthy body weight. People with a lot of visceral fat, also known as central obesity, belly fat, or abdominal obesity, are especially at risk. Being overweight, obese causes the body to release chemicals that can destabilize the body's cardiovascular and metabolic systems. Being overweight, physically inactive and eating the wrong foods all contribute to our risk of developing type 2 diabetes. Drinking just 1 can of non-diet soda per day can raise our risk of developing type 2 diabetes by 22%, researchers from Imperial College London reported in the journal Diabetologia. The scientists believe that the impact of sugary soft drinks on diabetes risk may be a direct one, rather than simply an influence on body weight. The risk of developing type 2 diabetes is also greater as we get older. Experts are not completely sure why, but say that as we age we tend to put on weight and become less physically active. Those with a close relative who had type 2 diabetes, people of Middle Eastern, African, or South Asian descent also have a high risk of developing the disease. Men whose testosterone levels are low have been found to have a high risk of developing type 2 diabetes. Researchers from the University of Edinburgh, Scotland, say that low testosterone levels are linked to insulin resistance. 3. Gestational diabetes. This type affects females during pregnancy. Some women have very high levels of glucose in their blood, and their bodies are unable to produce enough insulin to transport all of the glucose into their cells, resulting in progressively rising levels of glucose. Diagnosis of gestational diabetes is made during pregnancy. The majority of gestational diabetes patients can control their diabetes with exercise and diet. Between 10% to 20% of them will need to take some kind of blood glucose controlling medications. Undiagnosed or uncontrolled gestational diabetes can raise the risk of complications during childbirth. The baby may be bigger than he or she should be. Diabetes symptoms. 1. Thirst. 2. Hyperglycemia. 3. Blurred vision. 4. Polydipsia. 5. Hypoglycemia. 6. Frequent urination. 7. Polyuria. 8. Hypertension. 9. Peripheral neuropathy. 10. Obesity. 11. Paresthesia. 12. Polyphagia. 13. Erectile dysfunction. 14. Xerostomia. What is prediabetes? The vast majority of patients with type 2 diabetes initially had prediabetes. Their blood glucose levels were higher than normal, but not high enough to merit a diabetes diagnosis. The cells in the body are becoming resistant to insulin. Studies have indicated that even at the prediabetes stage, some damage to the circulatory system and the heart may already have occurred. Diabetes is a metabolism disorder. Diabetes mellitus, is classed as a metabolism disorder. Metabolism refers to the way our bodies use digested food for energy and growth. Most of what we eat is broken down into glucose. Glucose is a form of sugar in the blood. It is the principal source of fuel for our bodies. When our food is digested, the glucose makes its way to our bloodstream. Our cells use the glucose for energy and growth. However, glucose cannot enter our cells without insulin being present. Insulin makes it possible for our cells to take in the glucose. Insulin is a hormone that is produced by the pancreas. After eating, the pancreas automatically releases an adequate quantity of insulin to move the glucose present in our blood into the cells. As soon as glucose enters the cell's blood, glucose levels drop. A person with diabetes has a condition in which the quantity of glucose in the blood is too elevated, hyperglycemia. This is because the body either does not produce enough insulin, produces no insulin, or has cells that do not respond properly to the insulin the pancreas produces. This results in too much glucose building up in the blood. This excess blood glucose eventually passes out of the body in urine. So, even though the blood has plenty of glucose, the cells are not getting it for their essential energy and growth requirements. How to determine whether you have diabetes, prediabetes, or neither? Doctors can determine whether a patient has a normal metabolism, prediabetes or diabetes in one of three different ways. There are three possible tests. The A1C test. At least 6.5% means diabetes. Between 5.7% and 5.99% means prediabetes. Less than 5.7% means normal. The FPG, fasting plasma glucose, test. At least 126 mg/dl means diabetes. Between 100 mg/dl and 125.99 mg/dl means prediabetes. Less than 100 mg/dl means normal. An abnormal reading following the FPG means the patient has impaired fasting glucose, IFG. The OGTT, oral glucose tolerance test. At least 200 mg/dl means diabetes. Between 140 and 199.9 mg/dl means prediabetes. Less than 140 mg/dl means normal. An abnormal reading following the OGTT means the patient has impaired glucose tolerance, IGT. Why is it called diabetes mellitus? Diabetes comes from Greek, and it means a siphon. Erudis the Cappadocian, a Greek physician during the 2nd century AD, named the condition diabane. He described patients who were passing too much water, polyuria, like a siphon. The word became diabetes from the English adoption of the medieval Latin diabetes. In 1675, Thomas Willis added mellitus to the term, although it is commonly referred to simply as diabetes. Mel in Latin means honey, the urine and blood of people with diabetes has excess glucose, and glucose is sweet like honey. Diabetes mellitus can literally mean siphoning off sweet water. In ancient China, people observed that ants would be attracted to some people's urine, because it was sweet. The term sweet urine disease was coined. Controlling diabetes, treatment is effective and important. All types of diabetes are treatable. Diabetes type 1 lasts a lifetime, there's no known cure. Type 2 usually lasts a lifetime. However, some people have managed to get rid of their symptoms without medication, through a combination of exercise, diet and body weight control. Diabetes equipment and a healthy breakfast. Special diets can help sufferers of type 2 diabetes control the condition. Patients with type 1 are treated with regular insulin injections, as well as a special diet and exercise. Patients with type 2 diabetes are usually treated with tablets, exercise and a special diet, but sometimes insulin injections are also required. If diabetes is not adequately controlled, the patient has a significantly high risk of developing complications. Complications linked to badly controlled diabetes. Below is a list of possible complications that can be caused by badly controlled diabetes. 1. Eye complications, glaucoma, cataracts, diabetic retinopathy, and some others. 2. Foot complications, neuropathy, ulcers, and sometimes gangrene, which may require that the foot be amputated. 3. Skin complications. People with diabetes are more susceptible to skin infections and skin disorders. 4. Heart problems, such as ischemic heart disease, when the blood supply to the heart muscle is diminished. 5. Hypertension, common in people with diabetes, which can raise the risk of kidney disease, eye problems, heart attack and stroke. 6. Mental health, uncontrolled diabetes raises the risk of suffering from depression, anxiety and some other mental disorders. 7. Hearing loss, diabetes patients have a high risk of developing hearing problems. 8. Gum disease. There is a much higher prevalence of gum disease among diabetes patients. 9. Gastroparesis, the muscles of the stomach stop working properly. 10. Ketoacidosis, a combination of ketosis and acidosis, accumulation of ketone bodies and acidity in the blood. 11. Neuropathy, diabetic neuropathy is a type of nerve damage which can lead to several different problems. 12. HHNS, hyperosmolar hyperglycemic non-ketotic syndrome, blood glucose levels shoot up too high, and there are no ketones present in the blood or urine. It is an emergency condition. 13. Nephropathy, uncontrolled blood pressure can lead to kidney disease. 14. PAD, peripheral arterial disease, symptoms may include pain in the leg, tingling and sometimes problems walking properly. 15. Stroke, if blood pressure, cholesterol levels, and blood glucose levels are not controlled, the risk of stroke increases significantly. 16. Erectile dysfunction, male impotence. 17. Infections, people with badly controlled diabetes are much more susceptible to infections. 18. Healing of wounds, cuts and lesions take much longer to heal. It is possible to have a diabetes with only very mild symptoms or without developing any symptoms at all. Such cases can leave some people with diabetes unaware of the condition and undiagnosed. This happens in around half of people with type 2 diabetes. A condition known as prediabetes that often leads to type 2 diabetes also produces no symptoms. Type 2 diabetes and its symptoms develop slowly. Type 1 diabetes can go unnoticed but is less likely to do so. Some of its symptoms listed below can come on abruptly and be accompanied by nausea, vomiting or stomach pains. It is important to see a doctor if there is any suspicion of diabetes or if any of the below signs and symptoms are present. Prompt diagnosis and management lowers the likelihood of serious complications. The most common symptoms are related to hyperglycemia, high blood sugar levels, especially the classic symptoms of diabetes, frequent urination and thirst. Fatigue related to dehydration and eating problems can also be related to high blood sugars. The International Diabetes Foundation highlight 4 symptoms that should prompt someone to get checked for diabetes as soon as possible. Common symptoms of diabetes. The most common signs and symptoms of a diabetes are 1. Frequent urination water. 2. Excessive thirst and frequent urination are classic symptoms of diabetes. Have you been going to the bathroom to urinate more often recently? Do you notice that you spend most of the day going to the toilet? When there is too much glucose, sugar, in your blood, you will urinate more often. If your insulin is ineffective, or not there at all, your kidneys cannot filter the glucose back into the blood. The kidneys will take water from your blood in order to dilute the glucose, which in turn fills up your bladder. Disproportionate thirst. If you are urinating more than usual, you will need to replace that lost liquid. You will be drinking more than usual. Have you been drinking more than usual lately? 1. Intense hunger. As the insulin in your blood is not working properly, or is not there at all, and your cells are not getting their energy, your body may react by trying to find more energy, food. You will become hungry. 2. Weight gain. This might be the result of the above symptom, intense hunger. 3. Unusual weight loss. This is more common among people with diabetes type 1. As your body is not making insulin, it will seek out another energy source. The cells aren't getting glucose. Muscle tissue and fat will be broken down for energy. As type 1 is of a more sudden onset and type 2 is much more gradual, weight loss is more noticeable with type 1. 4. Increased fatigue. If your insulin is not working properly, or is not there at all, glucose will not be entering your cells and providing them with energy. This will make you feel tired and listless. 5. Irritability. Irritability can be due to your lack of energy. 6. Blurred vision. This can be caused by tissue being pulled from your eye lenses. This affects your eye's ability to focus. With proper treatment, this can be treated. There are severe cases where blindness or prolonged vision problems can occur. 7. Cuts and bruises don't heal properly or quickly. Do you find cuts and bruises take a much longer time than usual to heal? When there is more sugar, glucose, in your body, its ability to heal can be undermined. 8. More skin and/or yeast infections. When there is more sugar in your body, its ability to recover from infections is affected. Women with diabetes find it especially difficult to recover from bladder and vaginal infections. 9. Itchy skin. A feeling of itchiness on your skin is sometimes a symptom of diabetes. 10. Gums are reddened or swollen. Gums pull away from teeth. If your gums are tender, reddened or swollen, this could be a sign of diabetes. Your teeth could become loose as the gums pull away from them. 11. Frequent gum disease, infection. as well as the previous gum symptoms, you may experience more frequent gum disease and/or gum infections. 12. Sexual dysfunction among men. If you are over 50 and experience frequent or constant sexual dysfunction, erectile dysfunction, it could be a symptom of diabetes. 13. Numbness or tingling, especially in your feet and hands. If there is too much sugar in your body, your nerves could become damaged, as could the tiny blood vessels that feed those nerves. You may experience tingling and/or numbness in your hands and feet. Diabetes can often be detected by carrying out a current test, which finds out whether excess glucose is present. This is normally backed up by a blood test, which measures blood glucose levels and can confirm if the cause of your symptoms is diabetes. If you are worried that you may have some of the above symptoms, you are recommended to talk to your doctor or qualified health professional. Statistics from the 2014 USA National Diabetes Fact Sheet from the CDC's National Diabetes Report. 29.1 million U.S. children and adults, 9.3% of the population, have diabetes. This is a rise from 25.8 million, 8.5%, in 2011. Researchers from the Jefferson School of Population Health, Philadelphia, Pennsylvania, published a study which estimates that by 2025 there could be 53.1 million people with diabetes. 21 million people have been diagnosed with diabetes, a rise from 18.8 million in 2011. About 8.1 million people with diabetes have not been diagnosed, a rise from 7 million in 2011. This equates to 27.8% of people with diabetes currently being undiagnosed. Diagnosed and undiagnosed diabetes among people aged 20 years or older, U.S., 2012 stats from the CDC's National Diabetes Report. About 86 million Americans aged 20 years or older have prediabetes. 1.7 million people aged 20 years or more were newly diagnosed with diabetes in 2012. 208,000, 0.25%, people younger than 20 years have diabetes. Approximately 1 in every 400 kids and teenagers has diabetes. 12.3% of people aged 20 plus years have diabetes, a total of 28.9 million individuals. 25.9% of people aged 65 plus years have diabetes, a total of 11.2 million people. 13.6% of men have diabetes, a total of 15.5 million people, a rise from 11.8% in 2010. 11.2% of women have diabetes, a total of 13.4 million people, a rise from 10.8% in 2010. Diabetes in the UK. In the United Kingdom there are about 3.8 million people with diabetes, according to the National Health Service. Diabetes UK, a charity, believes this number will jump to 6.2 million by 2035, and the National Health Service will be spending as much as 17% of its healthcare budget on diabetes by then. Diabetes spreads in Southeast Asia. Diabetes is rapidly spreading in Southeast Asia as people embrace American fast foods, such as hamburgers, hot dogs, French fries and pizza. More Chinese adults who live in Singapore are dying of heart disease and developing type 2 diabetes than ever before, researchers from the University of Minnesota School of Public Health and the National University of Singapore reported in the journal Circulation. The authors found that Chinese adults in Singapore who eat American-style junk foods twice a week had a 56% greater risk of dying prematurely from heart disease, while their risk of developing type 2 diabetes rose 27%, compared to their counterparts who never touched the stuff. There was 80% higher likelihood of dying from coronary heart disease for those eating fast foods 4 times per week. Some facts and myths about diabetes. Many presumed facts are thrown about in the paper press, magazines and on the internet regarding diabetes. Some of them are, in fact, myths. It is important that people with diabetes, pre-diabetes, their loved ones, employers and schools have an accurate picture of the disease. Below are some diabetes myths. Exercise is important for people with diabetes, as it is for everybody else. Exercise helps manage body weight, improves cardiovascular health, improves mood, helps blood sugar control, and relieves stress. Patients should discuss exercise with their doctor first. Fat people always develop type 2 diabetes eventually. This is not true. Being overweight or obese raises the risk of becoming diabetic. They are risk factors, but do not mean that an obese person will definitely become diabetic. Many people with type 2 diabetes were never overweight. The majority of overweight people do not develop type 2 diabetes. Diabetes is a nuisance, but not serious. 2/3 of diabetes patients die prematurely from stroke or heart disease. The life expectancy of a person with diabetes is from 5 to 10 years shorter than other people's. Diabetes is a serious disease. Children can outgrow diabetes. This is not true. Nearly all children with diabetes have type 1, insulin-producing beta cells in the pancreas have been destroyed. These never come back. Children with type 1 diabetes will need to take insulin for the rest of their lives, unless a cure is found one day. Don't eat too much sugar, you will become diabetic. This is not true. A person with diabetes type 1 developed the disease because their immune system destroyed the insulin-producing beta cells. A diet high in calories, which can make people overweight, obese, raises the risk of developing type 2 diabetes, especially if there is a history of this disease in the family. I know when my blood sugar levels are high or low. Very high or low blood sugar levels may cause some symptoms, such as weakness, fatigue and extreme thirst. However, levels need to be fluctuating a lot for symptoms to be felt. The only way to be sure about your blood sugar levels is to test them regularly. Researchers from the University of Copenhagen, Denmark showed that even very slight rises in blood glucose levels significantly raise the risk of ischemic heart disease. Diabetes diets are different from other people's. The diet doctors and specialized nutritionists recommend for diabetes patients are healthy ones, healthy for everybody, including people without the disease. Meals should contain plenty of vegetables, fruit, whole grains, and they should be low in salt and sugar, and saturated or trans fat. Experts say that there is no need to buy special diabetic foods because they offer no special benefit, compared to the healthy things we can buy in most shops. High blood sugar levels are fine for some, while for others they were a sign of diabetes. High blood sugar levels are never normal for anybody. Some illnesses, mental stress and steroids can cause temporary hikes in blood sugar levels in people without diabetes. Anybody with higher than normal blood sugar levels or sugar in their urine should be checked for diabetes by a healthcare professional. Diabetics cannot eat bread, potatoes or pasta. People with diabetes can eat starchy foods. However, they must keep an eye on the size of the portions. Whole grain starchy foods are better, as is the case for people without diabetes. One person can transmit diabetes to another person. Just like a broken leg is not infectious or contagious, a parent may pass on, through their genes to their offspring, a higher susceptibility to developing the disease. Only older people develop type 2 diabetes. Things are changing. A growing number of children and teenagers are developing type 2 diabetes. Experts say that this is linked to the explosion in childhood obesity rates, poor diet, and physical inactivity. I have to go on insulin. This must mean my diabetes is severe. People take insulin when diet alone or diet with oral or non-insulin injectable diabetes drugs. Do not provide good enough diabetes control, that's all. Insulin helps diabetes control. It does not usually have anything to do with the severity of the disease. If you have a diabetes, you cannot eat chocolates or sweets. People with diabetes can eat chocolates and sweets if they combine them with exercise or eat them as part of a healthy meal. Diabetes patients are more susceptible to colds and illnesses in general. A person with diabetes with good diabetes control is no more likely to become ill with a cold or something else than other people. However, when a diabetic catches a cold, their diabetes becomes harder to control, so they have a higher risk of complications. Accurate tests are available to doctors to definitively confirm a diagnosis of diabetes. Before tests are conducted, a diagnosis may be suspected when patients report certain symptoms. Doctors will evaluate these symptoms by asking questions about the patient's medical history. Doctors may also carry out a physical examination, including checks for complications that could have already developed, examining the feet for changes in sensation, for example. Testing can be part of routine screening for people at risk of the disease, who may show up as having pre-diabetes. The U.S. Department of Health and Human Services recommends diabetes testing for anyone overweight at the age of 45 years and over, alongside anyone under the age of 45 with one or more of the following risk factors. 1. Hypertension, high blood pressure. 2. High cholesterol. 3. History of a diabetes in the family. 4. African American, Asian American, Latino, Hispanic American, Native American or Pacific Islander background. 5. History of gestational diabetes, diabetes during pregnancy, or delivering a baby over 9 pounds. 6. Blood tests for diabetes diagnosis. Finger prick for blood test. Diagnoses of diabetes are confirmed through one of 3 types of blood test. One of three blood tests can be used to confirm a diagnosis of diabetes. 1. Fasting plasma glucose, FPG, levels, a blood test after 8 hours of no eating. 2. Glycosylated hemoglobin, A1C, to measure a marker of the average blood glucose level over the past 2-3 months. 3. Oral glucose tolerance testing, OGTT, a test used less frequently that measures levels before and 2 hours after consuming a sweet drink. Concentrated glucose solution. 4. Glycosylated hemoglobin is often abbreviated to A1C, and this blood test is also used in the monitoring of diabetes management. 5. To make an initial diagnosis, an A1C reading must be 6.5% or higher. An A1C result between 5.7% and 6.4% indicates prediabetes and risk of type 2 diabetes. A1C is the preferred blood test for diagnosis because, while it is more expensive than the FPG test, it has advantages, including urine sample. Urine tests for diabetes were once common but are no longer considered reliable. Greater convenience. No need for fasting. Less day-to-day variation during stress and illness. When the fasting plasma glucose test is used to confirm symptoms, diabetes is diagnosed at levels equal to or above 126 mg/dL, 7.0 millimoles/L. For oral glucose tolerance testing, the plasma glucose levels after 2 hours need to be equal to or above 200 mg/dL, 11.1 millimoles/L, for a diabetes diagnosis. Another blood test is the random plasma glucose test, taken regardless of time and eating, which diagnoses diabetes if the level is at least 200 mg/dL, 11.1 millimoles/L. Unless the clinical picture is clear, a positive blood test should also be repeated to rule out laboratory error. Urine tests for diabetes diagnosis. Urine tests are no longer used to make a diagnosis of diabetes, although they were once common. Blood tests are used instead because urine tests are not sensitive or specific enough and offer only a crude indication of high blood sugar levels. A urine sample may be used, however, to test for ketones, particularly in people with type 1 diabetes who exhibit certain symptoms. Here, the test can pick up ketoacidosis, a complication of a diabetes. Type 1 diabetes makes up around 5% of all cases of diabetes. What is type 1 diabetes? Children selecting fruit to eat. Type 1 diabetes usually first appears in childhood or adolescence. In type 1 diabetes, the pancreas is unable to produce any insulin, a hormone that controls blood sugar levels. Insulin production becomes inadequate for the control of blood glucose levels due to the gradual destruction of beta cells in the pancreas. This destruction progresses without notice over time until the mass of these cells decreases to the extent that the amount of insulin produced is insufficient. Type 1 diabetes typically appears in childhood or adolescence, but its onset is also possible in adulthood. When it develops later in life, type 1 diabetes can be mistaken initially for type 2 diabetes. Correctly diagnosed, it is known as latent autoimmune diabetes of adulthood. Causes of type 1 diabetes. The gradual destruction of beta cells in the pancreas that eventually results in the onset of type 1 diabetes is the result of autoimmune destruction. The immune system turning against the body's own cells is possibly triggered by an environmental factor exposed to people who have a genetic susceptibility. Although the mechanisms of type 1 diabetes etiology are unclear, they are thought to involve the interaction of multiple factors. 1. Susceptibility genes, some of which are carried by over 90% of patients with type 1 diabetes. Some populations, Scandinavians and Sardinians, for example, are more likely to have susceptibility genes. 2. Autoantigens, proteins thought to be released or exposed during normal pancreas beta cell turnover or injury such as that caused by infection. The autoantigens activate an immune response resulting in beta cell destruction. 3. Viruses, Coxsackie virus, rubella virus, cytomegalovirus, Epstein-Barr virus and retroviruses are among those that have been linked to type 1 diabetes. 4. Diet, infant exposure to dairy products, high nitrates in drinking water and low vitamin D intake have also been linked to the development of type 1 diabetes. Life with type 1 diabetes. Diabetes monitoring. Healthcare professionals usually teach people with type 1 diabetes to self-manage the condition. Type 1 diabetes always requires insulin treatment and an insulin pump or daily injections will be a lifelong requirement to keep blood sugar levels under control. The condition used to be known as insulin-dependent diabetes. After the diagnosis of type 1 diabetes, healthcare providers will help patients learn how to self-monitor via finger stick testing the signs of hypoglycemia. hyperglycemia and other diabetic complications. Most patients will also be taught how to adjust their insulin doses. As with other forms of diabetes, nutrition and physical activity and exercise are important elements of the lifestyle management of the disease. What is type 2 diabetes? Type 2 diabetes mellitus most commonly develops in adulthood and is more likely to occur in people who are overweight and physically inactive. Unlike type 1 diabetes, which currently cannot be prevented, many of the risk factors for type 2 diabetes can be modified. For many people, therefore, it is possible to prevent the condition. The International Diabetes Foundation highlight 4 symptoms that signal the need for diabetes testing: frequent urination, weight loss, lack of energy, excessive thirst. To learn more, visit the Knowledge Center articles about symptoms or diagnosis. Causes of type 2 diabetes. Insulin resistance is usually the precursor to type 2 diabetes, a condition in which more insulin than usual is needed for glucose to enter cells. 3 Insulin resistance in the liver results in more glucose production, while resistance in peripheral tissues means glucose uptake is impaired. Obese male abdomen. Obesity can lead to insulin resistance, often the precursor to the development of type 2 diabetes. The impairment stimulates the pancreas to make more insulin, but eventually the pancreas is unable to make enough to prevent blood sugar levels from rising too high. 3. Genetics plays a part in type 2 diabetes. Relatives of people with the disease are at a higher risk, and the prevalence of the condition is higher, in particular among Native Americans, Hispanic and Asian people. Obesity and weight gain are important factors that lead to insulin resistance in type 2 diabetes, with genetics, diet, exercise and lifestyle all playing a part. Body fat has hormonal effects on the effect of insulin and glucose metabolism. Once type 2 diabetes has been diagnosed, healthcare providers can help patients with a program of education and monitoring, including how to spot the signs of hypoglycemia, hyperglycemia and other diabetic complications. As with other forms of diabetes, nutrition and physical activity and exercise are important elements of the lifestyle management of the condition. For more information on how type 1 and type 2 diabetes compare, read our article, The Difference Between Type 1 and Type 2 Diabetes. Causes of diabetes. Complications. High blood glucose levels are damaging to blood vessels and can increase the likelihood of them narrowing through atherosclerosis. This damage also leads to poor supply of blood to nerves. Poorly controlled hyperglycemia persisting for years can lead to complications affecting small blood vessels, microvascular complications, large blood vessels, macrovascular complications, or both. The process by which vascular disease develops is complex and occurs via numerous pathways that scientists continue to investigate. What complications are caused by diabetes? Microvascular complications, those resulting from damage to small blood vessels, are the most common complications of diabetes and include retinopathy, disease of the eye; nephropathy, disease of the kidneys; neuropathy, disease of the nerves; macrovascular complications, those resulting from damage to large blood vessels, include colon 2, angina pectoris and heart attack; transient ischemic attacks and strokes; peripheral arterial disease; diabetic retinopathy in older person's eye. People with diabetes should go for regular professional eye checks. Diabetic retinopathy is an eye complication caused by disease of the tiny blood vessels supplying the retina, the light-sensitive back of the eye. Early detection and preventive action are important. The symptoms do not appear before damage is done. Anyone with diabetes, whether type 1 or type 2, should have their eyes regularly checked by an optometrist or ophthalmologist. Most people with diabetic retinopathy do not lose their vision, but blindness is nonetheless a risk. The key to prevention is tight control over blood sugar levels. Interventions are also available for diabetic retinopathy, such as laser photocoagulation. Diabetic nephropathy. Diabetic nephropathy, kidney renal disease, is another complication caused by damage to small blood vessels. Diabetes is the cause of most cases of the most serious kidney disease, end-stage renal disease. 1 Nephropathy can also appear at other stages, from renal insufficiency through to chronic renal failure. There is a progressive decline in kidney function in terms of the glomerular filtration rate. 2. Nephropathy is diagnosed by urine test, and the primary treatment, as with other diabetes complications, is tight control of blood sugar levels. In addition, blood pressure treatment with drugs may be needed. Diabetic neuropathy. Diabetic neuropathy, a disease of nerves, is also a complication caused by damage to small blood vessels. In this case, It involves capillary supplying nerves. Foot complications. A diabetic foot. Diabetes can cause nerve damage in the feet. Wounds can go unnoticed and fail to heal properly. Complications affecting the foot, often referred to as diabetic foot, result from neuropathy, nerve damage that causes tingling sensations, burning or stinging pain, weakness or loss of feeling. The nerves become damaged due to restricted blood supply. The phenomenon can also affect the hands, but it is the feet that are most commonly affected. Because of the loss of sensation for heat, cold or pain, and a lack of attention given to the feet, they were at risk from injury, wounds, blisters or ulcers going unnoticed. If left unnoticed, this condition can lead to infection and even gangrene and potential amputation. Nerve damage leads to skin changes, making the foot dry and prone to cracking or peeling. Poor circulation to the feet caused by vessel narrowing can also mean that any infections or wounds heal less readily. The key to preventing foot complications is to monitor the feet so that problems are spotted at the first opportunity. Seeking medical attention for any problems is important, as is getting the feet checked by a healthcare professional, such as a podiatrist, at least annually. Two other practical measures include keeping the feet clean and dry, ensuring the nails are well maintained, wearing socks and shoes that fit comfortably and do not rub or squeeze the feet. Macrovascular complications. Disease of the large blood vessels caused by diabetes can lead to angina, transient ischemic attacks or stroke, heart attack and peripheral arterial disease. Alongside microvascular disease, macrovascular disease also contributes to the risk of the heart disease cardiomyopathy. Screening, history and physical examination diagnose macrovascular disease, and treatment includes tight control of blood sugar levels as well as lipid and blood pressure lowering therapies. Other strategies include smoking cessation, aspirin and drugs known as ACE inhibitors. Adults with diabetes are 2 to 4 times more likely to have heart disease or a stroke than those without diabetes. A number of risk factors in people with diabetes contribute to macrovascular complications. High blood pressure, abnormal cholesterol and high triglyceride levels, obesity, lack of physical activity, smoking. Prevention of diabetes complications. All the potential complications of diabetes can be prevented or controlled with tight glycemic control, which means keeping HbA1c levels below 7%. Measures to keep control of glucose levels, in addition to drugs or insulin treatment, include exercise and diet. Additionally, keeping control of blood pressure and lipid levels helps to prevent complications of diabetes. As discussed above, close monitoring of health so that potential complications are spotted at the first opportunity is also a preventive measure, including specific checks for the eyes and feet. How do oral drugs lower glucose levels? A box of metformin tablets. Metformin is the most widely used oral antihyperglycemic drug and reduces the amount of glucose released by the liver into the bloodstream. Oral antihyperglycemic drugs have 3 modes of action to reduce blood glucose levels. Secretagogues enhance insulin secretion by the pancreas. Sensitizers increase the sensitivity of the peripheral tissues to insulin. Inhibitors impair gastrointestinal absorption of glucose. Each class of antihyperglycemic drug has a different adverse event or safety profile, and side effects are the main consideration when it comes to choosing a medication. Possible side effects range from weight gain, through gastrointestinal ones such as diarrhea, to pancreatitis and more serious problems. What oral drugs are available for type 2 diabetes? No one particular choice of oral hypoglycemic is considered the most effective form of treatment. The decision over which drug to use is instead based on consideration of the adverse side effects, convenience and overall tolerability, personal preference. In reality, weighing up each drug is something to do in partnership with a prescriber. Guidelines partly drawn up by the American Diabetes Association list a great number of advantages and disadvantages for each of the available drug treatments, including the consideration of cost. The use of a single drug can be escalated to combination therapy with a second drug in an effort to improve glycemic control. Metformin is usually the first treatment offered, however, and it is the most widely used oral antihyperglycemic. Metformin is a sensitizer in the class known as biguanides. It works by reducing the amount of glucose released by the liver into the bloodstream and increasing cellular response to insulin. A metformin pill is usually taken twice a day. This drug is a low-cost antihyperglycemic with mild side effects that can include diarrhea and abdominal cramping. Metformin is not associated with weight gain or hypoglycemia. Sulfonylureas are secretagogues that increase pancreatic insulin secretion. There are several drug names in this class, including chloropropamide, glympyride, glipizide, glyburide. Again, the choice of drug is an individual one. In the case of sulfonylureas, the choice depends on daily dosing and the level of side effects. These drugs are associated with weight gain and hypoglycemia. Glitazones, also known as thiazolidinediones, are sensitizers. They increase the effect of insulin in the muscle and fat and reduce glucose production by the liver. Two glitazones are available, pioglitazone and rosiglitazone. These drugs can have the side effects of weight gain or swelling and are associated with increased risks of heart disease and stroke, bladder cancer and fractures. In the UK, rosiglitazone was withdrawn from the market over concerns about adverse events. In 2015, it remains available in the US, with information on its safety provided by the U.S. Food and Drug Administration, FDA. Alpha-glucosase inhibitors are intestinal enzyme inhibitors that block the breakdown of carbohydrates into glucose, reducing the amount absorbed in the gut. Available as acarbose and miglitol. They are not usually tried as first-line drugs because of common side effects of flatulence, diarrhea and bloating, although these may reduce over limit. Dipeptidylpeptidase 4, DPP4, inhibitors include linagliptin, linagliptin, saxagliptin and sitagliptin. Also known as gliptins, DPP4 inhibitors have a number of effects, including stimulating pancreatic insulin, by preventing the breakdown of the hormone GLP-1. They may also help with weight loss through an effect on appetite. These drugs do not increase the risk of hypoglycemia. Mild possible side effects are nausea and vomiting. Sodium glucose cotransporter 2, SGLT2, inhibitors include canagliflozin and dapagliflozin. They work by inhibiting the reabsorption of glucose in the kidneys, causing glucose to be excreted in the urine, glycosuria. SGLT2s may also cause modest weight loss. Side effects include urinary infection. Meglitinides include repaglinide and glinide. They stimulate the release of insulin by the pancreas. Meglitinides are associated with a higher chance of hypoglycemia and must be taken with meals 3 times a day. As a result, these drugs are less commonly used. The latest research on diabetes treatments. What diet is best for diabetes? Cow and milk. Choose skim milk and low-fat dairy products to help reduce fat intake. Having diabetes does not involve any particularly difficult dietary demands, and while sugary foods obviously affect blood glucose levels, the diet does not have to be completely sugar-free. Dietary concerns vary slightly for people with different types of diabetes. For people with type 1 diabetes, diet is about managing fluctuations in blood glucose levels, while for people with type 2 diabetes, it is about losing weight and restricting calorie intake. For people with type 1 diabetes, the timing of meals is particularly important in terms of glycemic control and in relation to the effects of insulin injection. In general, however, a healthy, balanced diet is all that is needed, and the benefits are not confined to good diabetes management, they also mean good heart health. A healthy diet typically includes a variety of fruits and vegetables, whole grains, low-fat dairy products, skinless poultry and fish, nuts and legumes and non-tropical vegetable oils. The following are some general dietary tips for a healthy lifestyle. Eat regularly, avoid the effects on glucose levels of skipping meals or having delayed meals because of work or long journeys. Take healthy snacks with you. Eat vegetables and fruits and eat them in place of high-calorie foods. A variety of fresh, frozen and canned is good, but avoid high-calorie sauces and food containing added salt or sugar. Whole grains high in fiber are recommended as a healthy source of carbohydrate. Sugar cubes. Try drinking water or tea and coffee instead of sugary drinks and avoid adding sugar to hot drinks. Eat pulses, a low-fat starchy source of protein and fiber, such as beans, lentils, chickpeas and garden peas. Reduce intake of saturated and trans fats by having poultry and fish without the skin and cooked, for example, under the grill, rather than fried. Take a similar approach to cooking red meat while reducing intake and looking for the leanest cuts. Eat fish twice a week or more, but avoid batters and frying. Go for oily fish such as salmon, mackerel, sardine, trout and herring, which are rich sources of omega. Avoid partially hydrogenated vegetable oils and limit saturated fat and trans fat. Replace them with monounsaturated and polyunsaturated fats. Dairy awareness helps reduce fat intake. Select skim, fat-free, milk and low-fat, 1%, dairy products, Reduce consumption of cheese and butter and swap out creamy sauces for tomato-based ones. Cut back on sugar by avoiding added sugars in drinks and foods. Have tea and coffee without sugar. Avoid fruit that is canned in syrup and pay attention to food labels. Cut back on salt. Prepare foods at home with little or no salt and avoid foods with high sodium such as processed foods. Cut back on portion sizes. Be wary of amounts consumed when eating out. Be wary of diabetic foods. They are of no particular benefit and can be expensive. Drink alcohol only in moderation. As a guide, no more than 1 drink a day for women and no more than 2 for men. Goals toward weight loss. Individual and group education sessions on diet and exercise. Meetings with diet and exercise counselors. Individually designed diet and exercise plans. Participants in the National Diabetes Prevention Program have access to a lifestyle coach to learn more about healthy eating and exercise. Obesity, diabetes and diet. Obesity is a risk factor for type 2 diabetes, and obesity in people who already have a diabetes results in poor control of blood sugar, blood pressure and cholesterol levels. Another concern with being overweight or having obesity is that it can worsen many of the complications of diabetes. Weight loss can be achieved by following the recommendations above and restricting the intake of calories.